Great start to your morning. We want to maybe pull the slides up and get going, and folks can kind of come in as they as they do. Thank you so much, Rebecca. All right, amazing. Good morning, everybody. Welcome to today's CHEI webinar, which is focused on how we combine quantitative survey data in numbers and information with lived experiences or qualitative data in stories and focus groups and interviews to tell a fuller story. I'm going to start off with a quick welcome and some introductions. Feel free to, in the chat, put in your name, what organization you might be coming from, if you have one that you're affiliated with, and pronouns. And then we'll do a quick little intro, like I think route builder is the word that we like to say. Not an icebreaker, kind of an icebreaker, but I know some people aren't too fond of icebreakers. So a route builder, I think, is the word we're using. Um, then a bit of an overview of what the Community Health Equity Initiative, or CHEI, is, which is the kind of umbrella organization program that is convening this webinar. Then a little bit of a way to connect more deeply with some of the specific qualitative work that's been happening at CHEI. A fabulous presentation from Tufts Interdisciplinary Evaluation Research, including a brilliant community evaluator who will share the research that they did, and some time to connect in breakouts with folks from across the state who might be doing similar work or having similar interests. Then we'll wrap up and talk about some next steps and what we'll share out with you after the webinar is over. With that, I think we can go to the next slide, which is our route builder, and I'm going to pass it over to Rebecca to kick us off.
Thanks, Isabella. All right, hopefully you all are seeing the Menti on screen. So for those of you who have been here before, you know the drill. You can either scan the QR code or open the link that I just put in the chat. And we would love to know what your favorite summertime event in your community is. And I think for me, it's probably NoHo Pride. It's a little bit south of me. I'm in Franklin County, but NoHo Pride is always a highlight. Concerts at Titus Sparrow Park, the beach, love it. Wake Up the Earth. What is that?
That's in Jamaica Plain. I miss that.
Oh,
I'm gonna miss that this year.
sounds like a blast. Fiesta, Franklin County Pride. That just happened on Saturday. Cookouts with friends, free landmark orchestra concerts on the Charles River, farmers markets, Amherst Farmers Market, walking on the Marginal Way. Oh, I love the mix of just like fun activities and I'm seeing some stuff in the chat too.
Yeah, we've got,
Brewfest.
oh, go ahead. You want it?
No, you're good.
Coast
Um,
Guard beach and bird watching, any brew fest.
Hiking, potluck, berry picking and flower events. There are so many pick your own strawberries places right now on the side of the road. It's awesome. The old time baseball game. Oh, these are fabulous. We'll give it like 10 more seconds. Awesome. Well, thank you all for sharing. I feel like I have a little bit of a mix of wanting to go do some new things and feeling bummed I missed some of these things this year. Um, and I think with that, I'm going to kick things back over to Isabella. Oh, I think you're muted.
All these years of doing virtual presentations, and you'd think I'd figure out when to unmute myself by now. Thank you so much for that, Rebecca. We tend to do route builders that focus on stuff that people like to do in their communities or things they're looking forward to. And I always love hearing about all the different events that you all are getting up to and the really, really wonderful community-based experiences that you can have in all corners of the state. And it always gives me some ideas for what I want. Previously, we were talking about the Garlic Festival, and that's still on my list from one of these webinars. So thank you so much for sharing. We'll share that Mentimeter out after the webinar's over. So you'll be able to see some of the recommendations from your colleagues and partners. Just a quick kickoff with who we are that have convened this webinar today. The Community Health Equity Initiative team, and specifically our team focusing on data and action, consists of some folks at the Massachusetts Department of Public Health, where I work and where this initiative is kind of funded, where it sits, as well as folks at the Metropolitan Area Planning Council and the Public Health Institute of Western Massachusetts, who are the ones who are doing a lot of the data and action work in terms of actually, if you want to get CHEI data or talk about how you can use the data to advance your work, they're the ones that'll do that. So really appreciate you all being here today with us and hopefully, familiarizing yourselves with the faces on the team so that if you go to ask for data or engage with us further, you'll know exactly who it is that you'll be working with. Now, next up, I'm just going to give a pretty quick high-level overview of what CHEI is. Oh my gosh, even I stumble over this acronym sometimes. So many of you are familiar with it, but if you're not, the Community Health Equity Initiative is a program that is kind of convened and funded by the state of Massachusetts to collect data on community conditions, things that impact people's health, but also things that impact people's ability to access the things that impact health. So think like economic stability, housing, experiences of discrimination, employment, all of those kind of conditions, with a focus on residents who experience health inequities and folks who are underrepresented or communities that are underrepresented in a lot of DPH's other data sources. So this is a really important way that we collect and use data that isn't available elsewhere to understand what it is that makes people in Massachusetts have the opportunities to be healthy. That's in two ways: the survey data, the data in numbers and questionnaires from the Community Health Equity Survey, which happens every 3 years. There's one happening in the 2026 summer fall period, so the next month or so. You'll be hearing a lot more from me about that as we get closer, as well as the qualitative data collected by resident community evaluators. And the way that we combine those two is really the focus of today's meeting. So you'll hear a lot from our next set of speakers about how those data are kind of linked and connected, the numbers data with the words and experiences data. We then use that data to make changes to things like policies, practices, and funding. A couple of quick high-level slides that touch a little bit on what I already shared. Next up is who are the communities of focus, who are the communities that experience health inequities and are underrepresented in DPH's data systems, that it's super important to us that we reach out to, collaborate with partners from these communities to develop our data collection, whether it's our survey data or our qualitative data, and share data back with partners in these communities so that they can use the data. Next up is a slide that goes over what I was just talking about as far as the topics, the things that give people the opportunity to be healthy. This is a lot of words, so I'm not going to read this one out, but it is going to be sent out in the slides if you want to go through it in more detail. The next slide talks a little bit about the survey and how we got kind of this data set that we have now that all of these data and action webinars are based off of. In 2023, we worked with hundreds of partners across the state to create this survey, translate it into 11 languages, and set response rate goals for our communities of focus that led to over 18,000 responses across the state. Like I mentioned, this will all be happening again this summer. So we are going to have a couple webinars where we talk much more in depth about what this process of getting the survey out and into communities looks like. But I'm going to go to the next slide because that's not really the focus of this webinar, and talk a little bit more about how it is that we use the data. This is a framework created by the Public Health Institute of Western Massachusetts. And it focuses on the ways that we can use data to work towards understanding what we want to know or what kind of case we want to make with the information, analyze it, use it to determine where our priorities lie, and act. So we're going to hear more from that, more from the tier folks, more from the Tufts Interdisciplinary Evaluation Research folks about this, but also want to note that this data and this kind of use of data is available to all of you through the ability to make a data request where you can get customized CHEI data for your community or your topic and meet with one of the folks from the Public Health Institute or the Metropolitan Area Planning Council to talk about how you can use the data and kind of place yourself on this framework and figure out where you can then use the data to inform what it is that you do. The next slide talks a little bit about what has been done across the state with the data from the over 135 requests we've gotten from community partners who have used the data for everything from informing programming, outreach, grant funding. I was going to say the Spanish American Center is up here, and I know I saw Melanie in the chat earlier. So we have some wonderful partners and great examples of how folks have used this data. At the state level, the data has been used from like DPH and our procurements, our programming, to the way that the Attorney General's office prioritizes investigations of labor violations. And then local and municipal public health partners have used it for needs assessments, for regional advocacy like the Neshoba Boards of Health have, and just a bunch more wonderful examples of ways that folks have used the data for programming, policy, and to win money that helps them make a change in their community. Now, the next one, I'm not going to say too much about this slide because I feel like I've been mentioning this on absolutely every slide, but not to sound like a broken record, we do have another set of data collection that's going to be launching later this year. You can sign up for our email list, which is going to be the way to kind of stay up to date with everything that's happening there, and a lot more resources to come, information like communications materials that you'll be able to order and use. We can even come to your events and help table if that would be helpful. So many different ways we can support you in reaching out to your community to make sure that your residents' experiences are included in this data set so that when the data set's being used to make decisions and win money and advocate for policies, the experiences of the folks in your community are reflected in that data. All right, I think that's it from me. And I'm going to go ahead and pass it off to the folks at the Tufts Interdisciplinary Evaluation Research, I believe, who are going to, is that who I'm passing it off to? Let me know.
I'm going to just share really quickly a little bit about the
Perfect.
data request process, but it's about you guys here, so.
I'm going to pass it off to Rebecca, and then she's going to pass it on from there. Wonderful. Thanks so much.
Awesome. So welcome everyone. Oh, that wasn't supposed to happen. That was spoilers galore. So I'm just going to share a little bit about the data request process that, like Isabella said, any one of you can submit a request and go through a similar process with one of the wonderful RDA providers. So our collaboration first began when TIER completed the data and action support form on the CHEI webpage. After that, we scheduled a meeting to talk with them a little bit about their request, what they were doing while they were collecting their qualitative data. We also shared some more context about the survey. TIER had done something that not everybody does, where they went through and selected questions that were of particular interest to them to pull. You can also come in with absolutely no idea what you want and just an interest in exploring. Over the next several months, we worked to pull together custom data tables based on what TIER was interested in learning about. We shared those tables with them. We met, we emailed back and forth, we talked about the data, talked about additional questions that had come up in our rounds of data pulls, and also next steps. Sometimes this would mean we would go back to the drawing board and we would pull some more data, and then kind of go through that process again. And the last piece that I'll say is that we did have to think creatively sometimes if there wasn't an exact question that aligned with something that the TIER folks were interested in. And a great example of that is the report that we'll talk about today. And by the end of the process, the TIER team was able to use the CHES data to help strengthen their reports. So with that, I would love to turn it over to our two wonderful speakers. Take it away.
Thank you, Rebecca. Hi, everyone. My name is Emma Posner, and I work at Tufts Interdisciplinary Evaluation Research, or TIER. I am joined today by my colleague, Davina, and today we'll be presenting a segment from our Mixed Methods report on youth experiencing housing instability with a focus on youth with experience in the foster care system. As I mentioned, Davina and I both work at TIER. I'm the project director for the project, and I'll let Davina introduce themselves.
Hi everyone, my name is Divina. Obviously, I work with TIER, but I'm also a local journalist with a shoestring out here in Western Mass, and do other work related to foster care advocacy on the side. Thank you so much for being here and listening to the presentation. We put a lot of work into it.
Yeah. So as Rebecca and Isabella mentioned, CHEI includes two data sources. So the statewide survey, or CHES, that gathers information on residents' most pressing needs, and the qualitative data, or interviews and focus groups, which are led by a team of community evaluators to understand topics and experiences that are difficult to assess or understand through surveys. The qualitative data collection process focused on understanding services and supports available to residents, barriers they face accessing them, and recommendations for how these services and resources in their communities could be improved. The interviews and focus groups were led by a team of community evaluators like Davina, who are residents across the state. Each of the 6 community evaluators brought personal or professional experiences and relationships within the different communities they engaged through their interviews and focus groups. They received training and mentorship from our team at TIER to carry out the qualitative data collection and analysis process. As part of our work, we created a series of mixed methods spotlights. These spotlights bring together the CHEI quantitative data, or the CHES or survey data, with the qualitative data that our community evaluators collected through interviews and focus groups. By looking at these two data sources together, we can add context and nuance that isn't possible by looking at either data source alone, and can identify patterns that help us better understand the experiences of residents in particular groups. So for example, qualitative data can tell us more about patterns or experiences that may be different from what we see in survey data. Or qualitative data can also affirm what we see in survey data and tell us more about how particular patterns in the data show up in people's daily lives. Today, we'll focus on the experiences of young people who have faced housing instability, but you can see on the right-hand side the different mixed method spotlights that our team developed, including for adults 65 years and older, on parents, and on people who are immigrants. And these spotlights will be available on the CHEI website in the coming months. The spotlight we'll present today, as I mentioned, explores on housing instability and other challenges that young people face. The survey findings, or quantitative data, in the spotlight focuses on experiences of young people affected by housing instability. We use CHES data to examine variation in young people's experiences, for example, with their perceptions of social support, comparing young people experiencing housing instability to those who are not. For the qualitative data, we're able to zoom in or focus in on a specific subpopulation of young people who experience high rates of housing instability, but who were not well represented in the CHES survey, young people leaving foster care. So the qualitative work was able to supplement the survey to document the experiences of young people leaving the foster care system. So the survey findings we'll present focus on data from young people 14 to 26 years old. And we compare, as I mentioned, the experiences of young people who reported experiencing housing instability in the survey to those who reported stable housing. The qualitative data we'll share was collected through 7 virtual interviews with young people ages 18 to 25 across Massachusetts who aged out of the foster care system. All interview participants were affected by some form of housing instability, such as periods of homelessness, frequent changes in housing placement, being kicked out or evicted from housing, or needing temporary or short-term stays. I know we went through these methods really quickly, but more information on our methods will be available in our mixed methods report that will be on the CHEI website in the coming months. So now we'll jump into the findings. The full version, as I mentioned, will be available on the CHEI website and focuses on 3 different aims. First, experiences meeting young people's basic needs. Second, young people's experiences or their barriers they encounter when accessing benefits, resources, and services. And third, the types of supports that they have or need. So we use both the survey and the qualitative data to highlight the experiences of young people, focusing on these 3 aims. In the interest of time today, we'll just be looking at the third aim, focused on the types of supports available to or needed by young people. But it is important to note that the feelings of isolation and access to mental health care that we'll share in our findings today are shaped by experiences and barriers covered across all 3 aims. So people's access to their basic needs and the barriers they face help shape the types of supports that they feel are available to them and their perceptions of those supports. So I'll start by sharing some quantitative or survey data, and then for each finding, I'll pass it to Davina, who will share the qualitative findings. So using the survey data, we first looked at feelings of isolation from others, which meant in the survey not having people to talk to or spend time with on a regular basis. We saw that young people who experienced housing instability were more likely to report that they felt isolated from others than young people with stable housing. So you can see the findings on the right. 17% of young people ages 14 to 26 with stable housing reported feeling isolated from others. When we zoomed in on young people who reported experiencing housing instability, we found that 45% indicated that they felt isolated from others. So they were 2.5 times more likely to report feeling isolated than young people with stable housing. Now, Davina will share qualitative findings on how young people aging out of the foster care system described their relationships and supports.
Thank you, Emma. So, for youth aging out of foster care, housing instability can worsen already challenging relationships or deeply impact the relationships that they've built or had for a long time. For some, that looked like having to return to unsafe or unhealthy housing situations, often where they had to fill a caretaking role for their parents and or their siblings. It can also look like separation from family members and loved ones, which can also increase or heighten feelings of isolation as well as exclusion on a systematic level. To hear directly from young people with lived experience who transitioned out of foster care, we'll have some quotes on the side. And the first one reads, I feel like the way I transitioned out kind of set me up for failure. Like the years that I had lived with my dad because I felt like I had nowhere else to go put me in a very unsafe predicament. It also put me in a predicament where I wasn't able to pursue the goals that I wanted to pursue. And another participant said, quote, so now that my siblings and I are all beyond the age of 21, so beforehand it was rough because we weren't together. We were all separated. But now that we're older and we're all, mobile, I have access to the T and I have my license, which is great. So, we can rent cars and meet up places now. So our bonding is definitely becoming stronger, but before that, it was tough. So while young people faced all kinds of instability, whether that was within their relationships, in employment, in housing, they still kept seeking community and care as they were transitioning out of foster care. One of the most consistent experience we heard from young people with foster care experience was how their caseworker and their relationship with their worker ultimately shaped their experience within the system, particularly their transition out of it, which of course was the focus of the study. So this was the case because caseworkers are often the main facilitator between a youth and the resources they receive. We heard a lot also about the role of community-based organizations and services and how they can support and foster feelings of normalcy by giving youth the opportunity to participate in age-appropriate activities that they might not have had access to while in their placements like group homes or foster homes. One of the implications that we'll touch on more at the end is that many participants also still had a desire for more supports and services related to housing, finances, and connection to peers with similar experiences. And hearing again from young people with lived experience, one said, quote, I also worked with a program. They do the funding for kids and they have helped me a bunch. Helped me go to concerts, helped me with the first little things in my apartment, like all that kind of stuff. When my car went bad and I had to get a new one, like all that kind of stuff been helpful with. Another participant said, I was homeless for a while. I ended up joining a program and basically they help be homeless youth. A lot of those youth were in foster care too, so I was able to listen and hear about some other conversations they had and aging out, stuff like that. I definitely know that if there were more resources for me, then it wouldn't have been as bad as it was for me, even though I don't have the most egregious case, I guess.
So next, we also explored whether young people could access mental health care when they needed it, comparing again access among young people with stable housing to those who reported experiencing housing instability. On the right, you can see that 83% of young people with stable housing reported receiving mental health care when they needed it, whereas 67% of young people experiencing housing instability reported receiving mental health care when they needed it. So compared to young people with stable housing, young people without stable housing were about 25% less likely to report receiving mental health care when they needed it. Davina will now highlight how the supports in mental health care youth aging out of the foster care system received often did not meet their needs. So I'll pass it back to Davina.
Yeah, so many of our participants often did not feel that providers were giving them appropriate, culturally sensitive, and trauma-informed care. And this lack of appropriate care or insufficient support led to some participants feeling powerless and worsening their health conditions and concerns, including mental and physical health. For example, one participant's sickle cell disease symptoms and their treatment was unsupported by their caseworker. So even when youth had access to care, it also didn't always meet their needs. And many also felt that there were frequent misunderstandings and mischaracterizations of their behaviors and needs. Some youth said that they felt racialized, disciplined, and overly medicated for their symptoms and circumstances rather than receiving supports and services. One quote says, I feel like my caseworker definitely just didn't understand me as a whole, not only just as a foster youth, but also as a Black foster youth. And that's just throughout DCF, that's an issue. Also, my caseworker was out of a different city, so I'm assuming that she probably didn't have a lot of cases with people of color. Another one participant said, my caseworker didn't understand sometimes my emotions, and she would automatically want me to go on medication. They had diagnosed me with a mental health condition when I was in there, just because I would have my outbursts because, missing my family. And that's one thing I used to hate. Like if something happened, they want to automatically put you on medicine. So, for summary and implications, as I mentioned earlier, um, many people affected by housing instability reported feeling isolated. Young people aging out of foster care described disruptions in family or personal relationships that were closely associated with housing instability and sought consistent, reliable, and trauma-informed support from social services and community-based programs. So, we had a small number of people, but an incredibly nuanced and rich experience where we learned a lot about the nature of transitioning out of foster care and the systematic implications of those individual experiences. Overall, we found that providing access to services and support and addressing the upstream factors that create these needs requires cross-sector collaboration. So, this includes policy and practice changes that expand access to meet the basic needs of youth related to housing, finances, and health, implementing and embedding more point people and guides that make it easier for young people to access resources like safe and affordable housing as they're transitioning out of care. It also means exploring the ways we can expand rental assistance, rent control, and guaranteed income, as well as formalizing the critical role of community-based organizations to meet the socioeconomic needs of youth through additional funding, service expansion, and more partnerships and cross-system collaboration.
Thank you, Davina. So as we mentioned, our team put together several different mixed methods, spotlights, and other products, and we hope that you'll keep an eye out for them sometime this summer. These include our mixed methods spotlights, so both the spotlight that we presented today, as well as our other spotlights that we mentioned at the beginning of the presentation. And these spotlights are all completed and put together in collaboration with the Department of Public Health and the Public Health Institute of Western Massachusetts, who, as Rebecca described at the beginning of our talk, pulled the data for the survey analysis. And then we will also be sharing our qualitative reports. And so these are 6 different qualitative reports that dive deep into the qualitative findings from each of the communities of focus that we engaged in the 2023 CHEI cycle. So I think we have a couple of minutes for questions, and then we'll pass it back to Rebecca and team. Kathleen.
Yes, I was interested in that. A couple of the youth talked about being part of a program that then helped them to meet some of their goals. And I just wondered about access to information about those helpful programs statewide, and whether that's information that kids are given when they leave foster care.
Mm. Kathleen, you're touching on a finding that's in the full report. And Davina, I wonder if you could kind of provide a sneak peek as to what some of those findings were.
Yeah, absolutely. So I kind of touched on this earlier with caseworkers being the main facilitator between youth and resources. So it's highly dependent on the information that they're given. Sometimes youth are able to ask questions to people above their caseworker, like an outreach worker or someone who runs a specific program within DCF. But often we found that information access was inconsistent and uneven between populations. And it was just very highly dependent. So if a youth didn't seek out that information on their own and wasn't receiving it from their social worker, then it's very likely that they did not get it. And I experienced something very similar because I aged out last month, for example, and it's just very highly dependent on your worker.
We have a couple of questions in the chat. One was, how does someone become a community evaluator?
Sure, I can take that. So we actually next week are releasing a call for community evaluators for this next CHEI cycle. And the process typically is there's an application that gets released, and then there's an interview process. And we work to kind of balance, ensure balance of experiences from different parts of the state and alignment with the broad kind of topics and communities that CHEI focuses on. So if folks are interested in learning more, we actually have a webinar next week on the CHEI qualitative data collection, where we'll share a little bit about the recruitment call for community evaluators. But you're also welcome to send me an email. I'm happy to answer questions. I'll drop my email in the chat.
And my apologies, that question came from Kia. And we also have a question from Jill. Could you explain what you meant by interviewing young people who weren't well represented in the survey data? Thanks.
Sure. So what I meant was this particular group of young people that Davina focused on for their qualitative data collection were young people who had recently aged out or were in the process of aging out of the foster care system between the ages of 18 and 25. And this population was not well represented in the survey sample. So the interviews allowed us to kind of understand those experiences. And I see Melanie with your hand.
Hi, this is a bit of a vague question, but it's really interesting to me, this topic, because we're doing a story drive right now to try and get people's stories at the center to celebrate our 60th year history. So I'm wondering if you have any tips on getting, excuse me, getting people to share their stories, or anything you would avoid.
I'm curious.
Yeah, I will say it was quite difficult for us to find folks to participate. The most success we'd had was getting in touch with people who are working within DCF themselves and community-based organizations who are working directly with youth that can connect you um, to the young people that they work with. I believe after we got the most amount of people after talking to someone relatively high ranking within DCF, I believe, Emma, if I'm remembering correctly. So I would reach out to social workers or department heads, as well as community-based organizations that are focused on outreach or that have like an outreach person. I would also
Thank
add
you.
that if
Thank
you're
you. Yeah,
able to compensate people for their lived experience, just because it is time, it is valued, and I think a
yeah,
lot of people are more motivated when they're taking time out of their day. Um, I think that's helpful.
absolutely. Absolutely. Okay, thank you.
Yes, Catherine, I see your message in the chat. Participants in the qualitative data collection were compensated for their time. A gift card.
Awesome. Thank you all so much for those really valuable questions. I think now I'm going to briefly turn it over to Barry to introduce our breakout room questions. So hopefully you can all see my screen here and take it away, Barry.
Thanks, Rebecca. Just doing a sound check if you can give me a thumbs up if you can hear me okay. Thanks. I had the fortunate to go to Ounce of Prevention conference yesterday and in hearing that presentation. Thank you both, Davina and Emma. Commissioner Goldstein offered a thought in his presentation, which was that data may point the way, but people show us where to go. And I think just hearing what was shared really gives us a good example of that. But it's one example because you all are here either out of interest, out of experience, and so we really want to take advantage of essentially some space that we can have together too. So we're offering these 3 prompts. Have you ever used a combination of qualitative, that is data with words, and quantitative, data with numbers, data to tell a story? What was that experience like? Think of a time a story, rather than a number or a statistic, change your perspective on a public health issue. What made it feel so impactful? And how can telling stories of qualitative and quantitative data help us work towards health equity? You'll see Rebecca just dropped those questions in the chat. You may just want to copy them, but they should carry over. But we're going to go into some breakouts, and we'd love if these could serve as discussion prompts for conversations we can have with one another. But at the same time, if there's other ways to connect in that space, please feel free to use it today. And I think with that, I'm going to give the green light to Isabella to send us into breakouts.
One quick thing before we go there. Can you please raise your virtual hand if you would like an ASL interpreter with you in the breakout room? I want to make sure that ASL interpreters follow folks into the correct spots.
Thanks, Isabel.
Right.
And how long will we be in the breakouts?
We'll be there for about 10 minutes or so before we come back, with hopefully about 2 or 3 minutes for any kind of things folks want to share back out to the full group before we wrap up by noon.
Great, thank you.
Okay, perfect. Thank you so much, Jill. Just want to note, I see your hand up and am on it with that assignment. Okay, and with that, I think it's time for breakout rooms to open. So I'm going to open all the rooms right now. Now everybody's back. I'm gonna pass it on to Rebecca to close us out.
Yes, thank you, Isabella. All right, I'm going to bring up my slides really fast and just talk a little bit about next steps. Before I do that, I hope that everyone had some great conversation in the breakouts. I know our group did. And I hope that you all took something away from today. I think it's so important to use both of these types of data together in order to tell all of these amazing stories. So as far as next steps, I know there are a whole bunch of links on there. I'm going to throw them in the chat as well. Please feel free to visit the CHEI website, spend time with the data. You can also submit a data request and spend some time with one of us to talk about what you're interested in and how we might be able to help with your work. And the very last piece is that I would love if you all could spend 2 minutes to fill out our webinar feedback survey. We really do look at those and we take the feedback that we get to heart to try to make these better for everyone. A couple of other things just to note, Emma mentioned this, but there will be a webinar next week as well from the Community Health Equity Qualitative folks titled Planning for Qualitative Data Collection and Action. So stay tuned. I believe Isabella has sent out that invitation link. So very excited for that. Also coming, oh, thank you, Isabella. She also just put it in the chat. Also coming sometime in 2027 we will have a data and action cohort. Again, some of you here were part of the cohort in the last CHEI cycle, and we're so excited to be thinking about that for this time. And here is the QR code for the feedback survey, but the link is also in that chat that I sent. And with that, I want to thank you all so much for coming today. It was so great to see all of your faces and have so much rich conversation. So thank you all.
Thank you.